Hello everyone, this is Professor Sulio here, and I am going to go over Nursing 346 Care of Populations and Communities. So just to give you a little bit of an overview about community health, the roles and responsibilities of community health are very important. Community health nurses have been working to improve population health in the United States since the early 1900s. These nurses, they manage and provide care across entire groups, identifying and examining the impact of diseases on societies and promoting wellness across a broad range of settings. Now, community health nurses, sometimes called public health nurses, are registered nurses. They're trained to work in public health settings such as county, state health departments, schools, jails, and businesses. Because of their roles in the community as caregivers, they often form close bonds with the communities they serve and form lasting relationships. Community health nurses are experts on health and wellness. You can find them working in wellness clinics, coordinating emergency preparedness for disaster relief, and treating injuries and illnesses. Just like the traditional nurse that works in a community setting, like hospital community setting, public health nurses also integrate evidence-based research with community health needs to provide care based on that science and evidence. We also determine the cultural and socioeconomic needs of the community and adjust care as needed. A public health nurse is highly recommended, highly preferred that they have a baccalaureate nursing education. This will allow the nurse to study the theory and the research behind public health practices and apply them to everyday practice. Some of the titles or roles that you will encounter in community health nursing will be disease prevention specialist, community educator, leader, researcher, advocate, caregiver, and so on. So public health nursing remains the largest discipline in the public health field, consistently providing leadership in an uncentered health system environment. And so now we're going to go back to the course here. The original course for spring may be a little bit different, but the majority of the content will be the same. So we start here with the home button on the left hand side of the screen, and you will see the video here, and then in this section here you'll see student resource course schedule, technical support, and course specific support. On the very right hand side of the screen you are going to see the course calendar with a to-do list, and this section here will have all the discussion due dates, the reflective journal due dates, the community health paper, the PowerPoint due date, and other things. Going back to the left hand side where we have the syllabus, modules, and assignments, you're also going to have a tab here that says announcements. So it'll be either set in between home and syllabus or syllabus and modules. The announcement tab is very important because it's going to have different announcements about the course and throughout the course. It will also have specific instructions on how to put together a reflective journal. Most of the things from journal A to B may overlap, but I have done my best to separate the overlapping of content from one journal to the next. In this course, you will choose a community health based clinic. It could be a diabetic clinic, um, drug, opioid type of clinic. It could be a cancer clinic. I mean, it can be really anything that is related to community. And you will go to that clinic and throughout the course add up to 42 hours of really being present in the clinic. So you can do 2 hours one day, 6 hours another day, 8 hours another day, as long as they add up to 42 hours. You will also have a login sheet that somebody has to sign at the clinic, and you submit that. I believe it's week 11, but again, the announcements will be there to guide you throughout the course. Next, clicking on the syllabus, making sure that you read the syllabus thoroughly. There's a course description, semester and credit hours. It's a 3 credit hour class, 2 didactic, 1 clinical. There's a required textbook, which is the Stanhope and Lancaster Foundations for Population Health. And then we have the APA book, the American Psychological Association. Course objectives, very important to reflect on the course objectives, especially on point 6 here where it is there's a link for healthy people objectives. Make sure you click on that link. It'll take you to Healthy People 2020, and you will see some other information on Healthy People 2030, but for now you will only focus on Healthy People 2020. Then we have learning activities. Again, as I mentioned, the clinical is unlike the traditional hospital setting where you go take care of the patients. This section will focus more on you being present at the facility that you choose, taking notes, obviously keeping the HIPAA in mind, privacy in mind, using initials only. In reality, you don't have to use any patient's name, or you just need to talk to the nurses, maybe the manager, getting information about everything that happens in the clinic without really getting into specific names and diagnosis for a patient or patients. Then we have a community assessment paper. This is a compilation of those reflective journals that you would write. And then the discussion here, make sure that you contribute to these discussions with a substantiative initial post and 2 peer substantiative responses. The Health Promotion Teaching Learning Project is the PowerPoint project. You will be presenting this project to the community group or agency at which you complete your clinical. So it is really a fun project to do. There are 2 online quizzes, just very easy. Nothing like the exams that you take on your med-surg courses. And the weekly reflective journals. Like I said, every announcement will have a specific layout of how to complete the reflective journal. So this is the breakdown of the course requirement here. Communication tips for success. Ask the professor tab, that's going to be under the discussion tab. Now I highly recommend that you post questions that will benefit the whole course here. If there's something that is individual, personal, then you use my Utica email, osulo@utica.edu. Below here are the 4 commitments you can expect from me in this course. Policy statements, late policy, grading policy, special needs. The grading scale is here, and then below here we have the course summary. So that's pretty much it on the syllabus. The assignments and the discussions, again, the assignments have the assignments and the discussions have the discussions. You will not have a discussion every week, but most of the weeks you will have a discussion. There's a library tab here which will be very useful if you need any articles. And that's pretty much it for the course, and I look forward to facilitating this class for you in the spring, and I wish you a happy 2019 and successful 2019. Thank you.